When it comes to writing the duration for an outpatient PT, OT, and or SLP plan of care for traditional Medicare, you have three options. I'm gonna give you three options, and I'm gonna give you the best option that I think you should be using to help you save time. And time is money. The most common way I see you doing it, that I think costs you time, hence money, is writing the duration as number of weeks. For example, 2 times per week for 6 weeks. And by writing it that way, you're saying it's 6 weeks and 6 weeks from today. You might get all 12 visits in. Great, but what if you only get 8 or 9 visits in because a patient cancel or no-shows, which now means after 6 weeks, you must do an updated plan of care. You gotta take extra time out of your day to create this plan of care, sign date it, send to the physician, and track that to make sure you get that back. You know, that's your time, that's an office manager's time, that's a front desk person's time, which amounts to money, and they could be doing something else. The second option, I think your best option to save time, hence money, is doing the duration as number of treatment sessions. For example, 2 times per week for 12 treatment sessions, which means those 12 treatment sessions may get done within 6 weeks, or maybe it takes 7, 8, 9 weeks because of cancels or no-shows. But that's okay if it took 6, 7, 8, 9 weeks because of the way you wrote duration. You don't have to do an updated plan of care as long as those 12 visits were done within 90 calendar days from the start of therapy. So you're saving time, hence money. A third option, which again is not my favorite way to do it, is, and here's an example, 3 times per week tapered to 1 time per week over 6 weeks. By doing it that way, in that example, what you're saying is week 1, they're coming in 3 times. By the time they get down to week 6, they're down to 1. In that example, you would not have a frequency because the frequency would depend on how they are or are not progressing. But again, by having that 6 weeks at the end, what if that patient needed more visits and needed 7 weeks, 8 weeks? Again, you're gonna have to do the updated plan of care, which takes your time, which costs you money. So I think the best way to do it, to save you time, save that therapist time, is number of treatment sessions for the duration. To learn much more about plan of care as it applies to traditional Medicare, be sure to click on the link below.